The Biden administration has announced a reversal of Trump-era limits on protections for transgender people in healthcare.
Yeah, but some doctors say that the plan will renew Obamacare rules that would force doctors to provide so-called puberty blocker and irreversible surgeries for patients identified as transgender, including children. Joining us now is the director of the Heritage Foundation's DeVos Center for Religion and Civil Society, Emilie Kao. Emilie, thank you so much for joining us.
Thank you.
So why do you think that this will ultimately force healthcare providers to do this?
Well, because the rule adds gender identity to the non-discrimination clause, which is a very controversial idea. Many doctors believe that their treatment should be based on the biological reality of their patients, and they don't want to do harm to patients. And some of these proposed treatments from the transgender community, like puberty blockers, cross-sex hormones, and surgeries, have been demonstrated to be harmful to patients with gender dysphoria. And there's no study that shows that they are beneficial.
And also, there's the psychological development of anybody who's a child. I mean, correct me if I'm wrong, I think you have to be at least 18 to go into the armed services. In most states, you have to be 21 to drink legally, although that used to be 18 in a lot more areas. So why the rush for something that can be so permanent?
Exactly. Why the rush for children? Because children who are, as young as 9 being put on puberty blockers, that means that they will not go through puberty. If they go onto cross-sex hormones, they will be sterilized. And children at that age are being put in the position of making decisions about medical care that could have irreversible consequences on their bodies. And they're at an age when, like you said, we don't allow them to go into the military, we don't allow them to drive. There are a lot of things that children are not allowed to decide for themselves, even getting a tattoo or getting piercings. And yet this rule would force doctors to put children onto very strong doses of hormones that could, in addition to sterilizing them, have harmful effects on their growth and really put them back in terms of their development.
So, Emilie, there's a lot of litigation around this. Are you involved in that, and where does this stand?
Well, there is a lot of litigation because this is such a controversial idea to treat patients according to gender identity instead of biological sex. So we have been watching the litigation and commenting on it for several years. There are medical professionals and hospitals who treat everybody. They treat patients who identify as transgender if they have, a broken bone or need cancer screening, the things that were mentioned by Dr. Rachel Levine. What they won't do, though, is they won't do harm to patients. They won't put people onto hormones and surgeries for the treatment of mental distress, because changing a person's appearance doesn't actually address or alleviate the mental distress that they feel.
How many of these kids do you feel are getting pressured by adults who are almost making political statements in pushing them?
That's a very good question. There are a lot of studies that have shown that actually the rise of gender dysphoria, particularly in girls, is because of social contagion, because they see adults, they see influencers on social identifying as transgender, and this is getting them a lot of, praise. And so there's been a rapid increase in the number of children, especially girls, identifying as transgender. And it's really not clear that they actually have the underlying condition of gender dysphoria. So treating them with hormones and surgeries would be very rash and, like I said, irreversible.
Right. Emilie Kao, thank you so much for coming on and talking to us about this.
Thank you.
Thanks for watching the Heritage Foundation's YouTube channel. With more than 500,000 members, we are the nation's largest conservative research and education institution. We believe the principles and ideas of the American founding are worth conserving and renewing. Please help us further our mission by subscribing to this channel and sharing our videos with your family and friends.